Welcome back to Champions of Care. We're talking about Parkinson's today, and we have with us the first neurosurgeon in Michigan to do a procedure called deep brain stimulation. That's Dr. Frederick Junn. We're so happy to have you here.
Thank you.
Now, you've done about 500 of these procedures so far. What is deep brain stimulation?
It's a way of controlling brain circuits with electricity, and we use a deep brain because the structures that we're controlling are deep from the surface of the brain, and they're tiny areas, and brain works through electricity and chemicals. And so by applying electricity in a right region, a right amount, we can alter brain function, and it results in the benefits that we want to see.
And how do you determine for which Parkinson's patients might deep brain stimulation help?
That's an easy question and a hard question. Easy because every Parkinson patient can benefit from deep brain stimulation because we know the circuits that are abnormal, so we can alter with the deep brain stimulation. But it carries a risk of having to put a wire into the brain. So most of the time, if you can achieve the same result with medications, then that's what patients will go on. So they are treated with medications. When to go on with a deep brain stimulation is a judgment call both from the doctor and patients and families. When medication treatments result in unacceptable side effects or not enough to control the symptoms of Parkinson's so that their quality of life deteriorates, then you sit down and talk about whether the risk with the surgery is justified. And if they are, then we go ahead and do the surgery.
Can you walk us through the procedure? And I know you brought some photographs to make this very complicated procedure a lot simpler. How does it work?
The brain, this is a cross-section of the brain looking front and back. And what you see are the different deep brain structures. And they're all involved in control of movement. So this is area called thalamus, globus pallidus, and the small area subthalamic nucleus. Believe it or not, there are wires, brain axons or brain connections going through all these regions.
Natural wires.
Connections, right. And in Parkinson's disease, this area called subthalamic is overactive. This area, globus pallidus, is overactive. This area is again underactive. So there are alterations from normal activities. And what we find is we put an electrical wire into these regions, and we apply electricity that alters that area's function, and it results in benefit. So how do we get the wires in? We have to first of all do surgery. So we have to make a small hole on the skull, and we implant fine wires to sample brain activities. And once we find it, and we find those areas that we saw in the diagram, we put in these permanent wires that we usually put it on two sides on Parkinson patients, and then that are connected to a battery source, which is like cardiac or heart pacemaker. And this needs to be connected, so we put another wire to connect the battery to the brain wire.
Now, I wouldn't see those wires, I wouldn't see the protrusions, that's all inside the skull.
They're all under the skin.
Does it hurt when you say electricity in my brain? I'm thinking shock and pain. Do I feel this?
Usually don't, but in high enough current, you will feel something, and they're usually transient. They come and go. And so as we turn on, you may notice it, and then as you get used to it, you don't feel it.
Well, this is very complicated and interesting surgery, so much so that we sent a video crew to watch you perform one of these surgeries so our viewers could really understand it even better. Let's take a look at that video now.
Under local anesthetic, we put in a metal frame called Lexel frame on this case, and then patient undergoes a CAT scan and MRI. And with using those two images, we figure out where we need to go roughly. So a patient is then brought to the operating room, and then we give patient a intravenous anesthetic which makes them sleepy. And during that time, we place a small hole called burr hole. It's size of dime on the skull, and then we open the brain cover. And by the time the intravenous sedation wears off, patient wakes up, but the hole is already made, and now we're ready to record the brain. And then you see the arc, and then the motor that's mounted on the frame that is driven remotely to advance a tiny brain wires called microelectrodes. Some people use one, we use 2 wires at the same time. And as it drives slowly through the brain, it picks up brain activities. And different regions of brain has a different signatures. And so we use that to recognize where we are, and certain portions of the brain actually respond to specific regions of the body. So you can actually see or hear the neurons as you touch the body parts, it responds appropriately. As he moves his wrist, the noise is going to change. Like a train, choo-choo train. And that gives a pretty good information as to where we are. And from there on, we can put in the macro electrode, a permanent electrode, deep brain stimulation electrode. And use that, we hook up to an external battery source and test out what the permanent electrode stimulation would be. Try to touch Christine's hand. You're not shaking as much as before, right? Yeah. And once we have good symptom relief and no side effects or minimal side effects, we then anchor the wire to the skull. And then we start closing. That's the end of the surgery. And the second part of the surgery, which is done next week, will connect the brain lead to the battery. It relieves the symptoms that are responsive to medications. So in general, it relieves their tremors, their rigidity, and also medication-induced side effects will be eliminated with the use of device. If people have a realistic expectations, not they're going to be perfect, but realistic expectation of some degree of improvement, I think that will make a surgeon's job a lot easier. Many times when we work, we don't see the fruit of our labor, right? You don't see ultimately what it has on down the stream, whereas in surgery, especially in neurosurgery, you know about your results right after the surgery. And most of the times, patients do well, and so you get reward every day.
Dr. Junn, how long does the deep brain stimulator last? Does it need to be replaced?
The deep brain stimulation depends on the battery source. So when the battery gets exhausted, then you have to have a replacement for the battery.
So it really is like a heart pacemaker.
Exactly, and it takes about 4 to 5 years for the battery to deplete it, and then we change it with another local small surgery.
That's a good battery, a 5-year battery. If a person who has had deep brain stimulation is getting good results, would they also need medications or any other therapies?
Yes, in the beginning, one may, if we do early, patients who are early in Parkinson's disease, they may not need medicines for a while. But unfortunately, even deep brain stimulation is not a cure for Parkinson's. It is another form of controlling symptoms. So as the disease progresses, the benefits of deep brain stimulation may feel like it's not as good as before. It is not that the deep brain stimulation is not working. It is that it's running out of brain circuits for it to work its magic. And same goes with the medications. So we, as the disease advances, we use combination of deep brain stimulation and medication to optimize patients' day-to-day function. Eventually, all of these therapies may fail in most advanced state of Parkinson's disease.
But at this point in time, there is no cure for Parkinson's disease, so therapies like deep brain stimulation and medications are the best tools we have to manage it.
Yes.
Well, I want to thank you so much for explaining these tools to our viewers today. Dr. Frederick Junn, I am so grateful you were here. Thank you.
Thank you.
We've been speaking today with Dr. Frederick Junn, Director of Neurosurgery at Oakwood Healthcare. He's taught us lots about Parkinson's disease and the treatment options. I want to thank Dr. Junn and also thank Dr. Mark Bustamante for being with us today. You can find out more information about movement disorders, about the Parkinson's support group, and about deep brain stimulation at oakwood.org, or call us at 1-800-543-WELL. Thank you for watching Champions of Care, and we'll see you next time.